And with it, of course, feeling like fall around here, it's also the start of flu season. We want to bring in Dr. David Winter from Baylor Scott White Health to talk about some common illnesses this time of year. Good morning, Dr. Winter.
Good morning, Tashara. Good to be with you.
Absolutely. Let's talk about flu first. Have you seen any flu cases yet?
I have seen flu. I saw one last week, and my partners have seen it also, so it's coming. We worry this may be a really bad flu season this year. It spread pretty rapidly in Europe just a month ago, and then last summer, Australia's winter season, they had a huge outbreak. So we think it's going to be a really bad flu season this year. So if you hadn't had a flu shot, you might ought to consider getting one right now. They do work.
And what are the predictions with COVID this fall? Are we going to see another surge with it?
Yeah, the big concern, Tashara, is two things. Number one, the immunity of America as a whole is waning, it's declining, because if you had COVID, you had some protection. But if that was 6 months ago, or if you had a COVID shot 6 months ago, that's a little bit too long, and your antibodies tend to decline. So that's decreased what we call herd immunity. Second, we have these new variants that are out. They're in Europe right now. BQ.1, BQ.1.1 is the other one. And they actually now are in Northeast America, New York, New Jersey. It was about 2% 2 weeks ago, up to 20% now. So new, more contagious variants. The good news is the new vaccine, the bivalent COVID vaccine, does work against them. But new variants coming, a lot of waning immunity. It may be a lot of surges coming up. We're worried about that this year.
Oh boy, something to be mindful of. And you know, a lot of folks, even this time of year, start to get together with the holiday season approaching. What should we do to help prevent the spread of infections?
Yeah, I think you ought to consider who you're going to be with. If you have friends or relatives that are old, maybe frail, if some of them have illnesses that make them more susceptible to infections, be careful around those folks. If you have head congestion, sore throat, cough, fever, you might want to stay away from them. We may tolerate those viruses better than they do, and some of those folks get seriously ill, and they're even deaths with that. So a lot of viruses circulating right now. You got COVID, you got influenza, you got respiratory syncytial virus, we call that RSV, and these bad boys are waiting for us to all to get together so they can jump around and spread further.
I know
a lot of things
it.
to be aware of right now.
Yeah, and I want to talk about that last bad boy that you mentioned, RSV infections. It's something that we've been talking about in many of our health stories, many reports of it in North Texas. Tell us about that disease.
Yeah, in adults, Tashara, it's just like a common cold. 2 or 3 days of head congestion, sore throat, not a bad illness. But in young kids, children 2 years and less, 1, 2 years old, they don't do very well at all. And there's been a huge outbreak of that around the country, particularly in North Texas. In fact, Cook County is just full of them right now. Just this week, they say they've had 1,000 new cases every day over there. Those kids don't do well, and the older folks don't do well with this either. There's no good treatment, so you want to try to avoid it. Avoiding is the same way we did with COVID, masking, distancing, don't be kissing those babies. And there's no vaccine right now. So RSV is a bad disease for young kids and older folks, and it's out there also. A lot of viruses. This is the fall season coming up, and get ready. We're going to have a little bit of roll this year.
Dr. Winter, real quickly, Ebola broken out in Africa. Any cases yet in America?
No, not yet. And thank goodness the U.S. government is actually making sure that if anybody comes from Uganda, they can only go to 5 airports where they're being screened. None in this area. It's Atlanta, Chicago, New York, New Jersey, Washington, D.C. There, if you've been to Uganda, they're going to keep you in isolation. They make sure you don't have it, so none here. But it's still going up. They say there's 24 deaths now in Uganda, in Central Africa. Maybe more than that. We think that's an underestimation. And this can be a real lethal illness. A lot of contagion, and the death rate can be as high as 90% in prior epidemics. So we got to watch this carefully. But right now, none so far in America.
Absolutely. Dr. Winter, always so good to talk to you and catch up on the latest health issues. Thanks so much for joining us.
Thank you. Have a good day.
You too.